our project is based on hypertension and hypertensive heart disease.
You have to compete with the fans, so you need to raise your volume.
Alright, so as we go through the PowerPoint, we're going to talk about the signs and symptoms, hypertension stages, basically some interventions we can do for like hypertensive patients. So what makes a good heart? Not only can love and affection contribute to a good heart, but also just exercising, being active, and just as simple as walking can contribute to your heart being a better shape. Why is it important to have a healthy heart? It's because it's one of the most important, or if not the most important organ in your body. You know, it pumps approximately like 2,000 gallons of blood on a daily basis, which goes to show how hard it's doing. And here are the stages of hypertension. So we all know like the normal blood pressure is 120 over 80, or if you're an athlete, it could be lower. So stage 1 of hypertension is basically between 130 and 139 over 80 and 89. And stage 2 is at least 140 over 90. And then hypertension crisis is over 100.
So there are signs and symptoms associated with hypertension. Primary hypertension are actually not accompanied by any symptoms in most cases. If you think of a normal blood pressure, which is 120 over 80, like we said, patients who have hypertension, their blood pressure is about 130 over 80. Secondary hypertension is usually associated with an underlying cause, patients who are generally stressed a lot, who have kidney diseases, obesity, thyroid issues, or even pregnancy can be a cause. Now there's hypertensive emergency, which is the more severe case, blood pressure that leads to stroke, heart attack, or heart failure. Patient's blood pressure systolic number would be over 180, and systolic pressure of 120. This can cause the blood pressure to be inflamed, and burst, and the heart to pump insufficiently. Some signs and symptoms for severe blood pressure would be chest pain, nausea, vomiting, severe anxiety, shortness of breath, or seizures. So there is no cure for hypertension, but there are a variety of things you can do to control it. The number one thing that a patient can do is change their diet, control the amount of fat and salt intake. There are also antihypertensive medications that help with keeping blood pressure low to avoid damage to other organs. The key is to detect it early, make changes before serious complications occur. So there are interventions, and this is where we come in, such as teaching patients by regular physical activities. The more the better, 5 times a week, running, jogging, dynamic aerobic exercises, swimming, weightlifting, things that they can do to reduce stress, such as yoga.
So how exactly does exercise relate to health? Here at Unity Tech Cardiac Rehab, we offer different programs patients can go through to improve overall heart condition. It is important to check vitals pre, during, and post-treatment to make sure that the heart is working properly. Studies show that patients should work out consistently and increase their blood pressure by as much as 10 millimeters per week on systolic side. It is important to note that working out inconsistently can cause blood pressure to be at greater risk of hypertension. We recommend aerobic exercises for patients to start out with, to the point they're able to hold a conversation and not overexert themselves for 30 minutes, 4 to 5 times a week.
Okay, now the key behind hypertension too is early detection, but the real issue with hypertension is the repeated pressure that it puts on the arterial walls. That's where the damage can come from. And even with primary hypertension, which is not related to anything else, that can lead to things like kidney damage, organ damage, etc. You can have, and that's most hypertension is what they call essential hypertension. And that just comes from stress, excessive weight, lack of activity, sedentary lifestyle, etc. So that's essential hypertension as opposed to hypertension that's caused by maybe kidney disease or any other underlying pathologies. Okay.
I actually have a question really quick. Do you guys think if your patient is on like blood pressure medication, that would kind of change up what kind of cardiovascular exercises you might do, or would you worry about their heart rate or their blood pressure not rising during exercise?
Yeah. I think it depends. I mean, I guess the important thing is for them to have exercise to lower the blood pressure. If they're on medication, I guess it depends on what medication they're on. So.
Now, I noticed that several times that you were checking your patient's pulse. How does that tie in with blood pressure? And what do you expect to see?
Well, I expect it should increase
Okay.
with exercise.
Mm-hmm. So what does that mean? What's happening with the blood pressure? If the pulse rate increases, what does that mean with the blood pressure? Go ahead. It should increase as well, yes. So I guess your baseline figures are probably the key in maintaining it so that you're not overexerting your patient. Okay, you need to know what baseline you're starting with and whether it's, as Jake pointed out, medication controlled is another issue. You may have a person with resting BP of non-medication controlled of 160/90, but with medication it's controlled to like 124/80. Okay, so one of the things I think you need to make sure of is that your patient, before you start exercising them, number one, A, are they on blood pressure medication? B, did they take their blood pressure medication before you started working with them? Okay? And the other piece, I think, is educating your patient to monitor their own vitals. In some cases, docs will advocate that you buy your own blood pressure cuff so that you can monitor your own blood pressure. Okay? Because you want to keep the pressure in those arteries down. If you keep the pressure in the arteries down, thereby you decrease the amount of potential damage that may occur from long-time hypertension. It is very possible from long-term hypertension to have a brain bleed. Okay, because the pressure on the cerebral arteries gets to a point where it forces, especially as you get older, it's going to force these arteries to become weaker and weaker, and then they're going to let go. And then you have a bleed into your brain, or an intracranial bleed. That's not a good scenario for anybody. Any other questions, folks?
I thought that was a Word document.
Obviously, it was a verbal document.